Hi, my name's Jennifer Hutton, and today we're going to talk about horse vital signs. To start with, you'll want to see the horse's normal behavior, and as you can see, she's kind of grumpy, but that's her normal, so we're used to that. And what we want to look is for brightness in the eyes, see if the horse is sweating, or if they're cold, or if they're overall just restless. So if your horse was showing signs of colic, you would start with gut sounds to make sure that, to check that first. But since we are dealing with a healthy horse today, we're going to start from the front and work our way back. So we're going to start with mucous membranes and capillary mucosa. Mucous membranes can be found in the conjunctiva of the eye, which you can see by pulling down lightly right here. If a horse has issues with the mucous membranes, it's normally a little swollen up there and a lot easier to see. The next and easier place to see mucous membranes is in the mouth, and the best way to do that is take one finger and lift, and you can see the color. So with the mucous membranes, there is a certain pink and moist color associated, and hers are just perfect. Some problems that you can find with the mucous membranes is if it's fiery red, it could be a sign of fever or infection. If it's brick red or like a purplish color, it could be a sign of cyanosis, like lack of oxygen. Another problem is pale in color, which could mean anemia or shock. Yellow could mean jaundice, which is problems with the liver. And the last one is if it's dry, that's a sign of dehydration. So with capillary refill time, it's a check to see if the horse is dehydrated. So you'll go ahead and lift up, and you'll take your other hand and put your thumb on there until the color goes away. And when the color goes away, then you lift up your finger, and it should be gone in back in 1 to 2 seconds. So another way to check hydration in a horse is the skin pinch test, which is a skin pliability test. So what you'll do is you'll pick up skin in the middle of the neck, pinch it lightly, and then release and count how long it takes for the skin to lay flat again. It should take 1 to 2 seconds, and as you can see, hers is just fine. Some things that can affect the skin pliability are age, and the position of the neck. So with the skin pliability test, in older horses, sometimes their skin tints a little longer. That is due to lack of, or losing their elasticity in their skin. So next thing we're going to check is the pulse. So you can check the pulse in 3 places. The maxillary artery right here under the jaw, the radial artery right behind the knee, and then the digital pulse, which you can find on the back of the fetlock. Now, with the digital pulse, you will only use it in case you feel like there's a problem with the foot, indicator of extra circulation into the hoof, which shows problems such as laminitis. So we're going to take the pulse at the maxillary artery, and it should be a reflection of the heart rate, which is a range between 32 and 44 beats per minute. It's the normal for most horses. So we'll go ahead and find it. It should feel like a wet noodle. And then we'll count. So I counted to 9, which when you for 15 seconds, I counted for 15 seconds and counted to 9, which times 4 would equal per minute. So 9 times 4 is 36. So we got 36 beats per minute, and that's just about average. So she's doing good. So next we're going to take her heart rate, which is found right below or behind the elbow of her against her heart girth. It should also be between 32 and 44 beats per minute. I'm going to go ahead and start the timer. heart rate, we take the 9 times 4, which equals 36. When we check the gut sounds, we always want to face the hind legs so that we make sure the horse isn't kicking at us. And just like keep an eye on our hind legs because that's what she's going to kick out with. So when I check the gut sounds, I choose to use the stethoscope just because I feel like it's safer for me to be not up against the horse. So we're going to start with the first quadrant. So that one's good. I just heard some gurgling. Also good. So now we're going to go to the other side and check that side as well. Continuing to face the hind legs. Good. Also good. So next we're going to check her respiratory rate, which should be between 8 and 16 breaths per minute. And since horses don't breathe as many times per minute as we do, we're going to count to 30 instead of 15 seconds. So you're going to watch the rise and fall of the side of their abdominal cavity instead of watching their nose because this is just her sniffing me. And we don't want to just count how many times she sniffs. So now I'm going to start the timer. So I counted to 6. I find it really helpful to breathe with them as a way to keep track. So I counted to 6 in 30 seconds, which means she's at 12 breaths per minute, which is right in the middle of the normal. So now we're going to check her gut sounds. We're looking for a constant sort of regular, not like all the time, but regular movement of the guts, which should be sounding like gurgles. What wouldn't be a sign, would be a sign of problems would be like a pinging, like a metallic noise. Some other issues would be if it was rushing, it's called hypermotility, which is a sign of like diarrhea or other such problems. And then the last problem is if there's no sounds, it's a sign of like blockages or something going on in the gut. Okay, so now we're going to do the temperature. For a horse, their temperature is normally between 99.5 and 101.5. So today we're going to use our digital thermometer and petroleum jelly as lubricant. So we make sure we use our finger to apply the petroleum jelly instead of inserting the thermometer into the petroleum jelly jar to avoid cross-contamination. So then we're going to just let her know we're back here. I'm going to softly lift her tail. We'll insert straight into the anus and then move it just to the side a little bit so that we take the temperature of the rectum wall instead of the manure. Take it straight out. So she has a temperature of 100.2, which is right in the average.